All right, thank you for joining us. This is the information session on tuberculosis. Just some housekeeping is to please remain on mute. Use the chat feature. You can send chat messages to me. I'm Caitlin Hodge. They'll be answered by our folks who have joined us, most of them towards the end of the session. We also have some directions there in Spanish about how to listen in Spanish to an interpreter during this. So we're also going to give some more instructions on how that works on the next slide. So just pausing here to let folks read that. There's an interpreter button near the bottom of your screen. You can listen in Spanish, you check that. If when you're listening in, you hear both English and Spanish at the same time, you'd want to click mute original audio. All right, and with that, I'd like to introduce who's joining us today. So from the Hanover Health Department, I'm Caitlin Hodge. I'm our Public Information Officer. I'm going to moderate our session today. We also have Karen Stalzer, who's our Health Department's nurse manager. And we have from the Virginia Department of Health, Laura Young, who's a tuberculosis epidemiologist. So thank you both for being on. We'd like to thank the Hanover County Public Schools for working with us and for being a part of this meeting. I'd like to hand it over to Dr. Gill to say hello. And I just need to unmute you, Dr. Gill, so one moment.
Well, thank you, Caitlin, and good evening, everyone. First and foremost, I want to thank you for giving up your time on a Thursday evening. I imagine this is not what any of you thought you would be doing on a Thursday evening, but we thank you for taking the time to do so. While this is a Hanover Health Department and Virginia Department of Health presentation, we do want you to know that Hanover County Public Schools has been good partners, not only in this, but have enjoyed the professional relationship always, but specifically over the last 3 years during the pandemic. You've heard joint messages from Hanover County Schools as well as the Hanover Health Department, and we value that partnership. Here again, we didn't think that this would be something we would be partnering in, but we are glad to know that we have the professionals at the Virginia Department of Health and the Hanover Health Department as part of that to lead us through and to educate all of us as part of this information session on tuberculosis. As we continue to navigate this, we have a number of individuals who have been and will continue to be partners from the school division in this process. On the call this evening, in part, we have several Hanover Schools individuals, but I want to specifically recognize the principal of Liberty Middle School, Mrs. Sherry Lysette, the principal of Patrick Henry High School, Mr. Chris Martinez. Terry Woody is on. Terry oversees and supervises all of our school nurses. Mrs. Mandy Baker, Assistant Superintendent of Human Resources, who is also the school division's liaison to the Hanover Health Department, as well as Mr. Chris Whitley, our Assistant Superintendent for Community Engagement. And again, we value our partnership and will be working with the Health Department every step of the way and are here to, again, assist you in any way that we can. Thank you, Caitlin. I'll turn it back to you.
Great, thanks. And I'm going to go over our agenda briefly. So why are we here tonight will be our first topic. We're also going to talk about what is tuberculosis and how it spreads, latent tuberculosis and tuberculosis disease, risk factors as well as testing, treatment, and what to expect next from your health department. And then we'll have time for questions. So now I'll hand it over to Laura.
All right, thank you so much, Dr. Gill and Caitlin, and thank you all for joining us tonight and taking time out of your busy lives. So really, we're all here together tonight to talk about this potential exposure to some of the active TB disease within the Hanover school communities, and we really want to inform you and provide information about TB, share information about what to expect next, and be transparent with you. You know, our concern is for your health and the health of our greater community. So we appreciate the time to share this information with you. So we want to get everyone on the same page and provide just some basics about what is tuberculosis or TB. And TB is a disease that's caused by a bacteria called Mycobacterium tuberculosis. The bacteria or the germs usually attack the lungs. That's what we think of as sort of classic TB. But they can attack any part of the body. They could attack the kidney or the spine or the brain or really anywhere. But when we talk about pulmonary TB, that's when we're talking about, again, that sort of classic picture of TB that we've maybe heard about, and that's TB in the lungs. If you hear about extrapulmonary TB, that's referring to TB somewhere else in the body, so outside of the lungs. TB is spread from person to person through the air, and not everyone who's exposed to TB becomes infected, and then not everyone who's infected with TB becomes sick. So to give a little more information on how TB spreads, again, it spreads from person to person, and you have to have someone with contagious TB, so they have TB disease, coughing, speaking, or singing. So they're actually, you know, pushing these infectious particles and germs into the air, and then someone else has to actually breathe those in. And then they go into your respiratory system, and then they can move from there throughout the rest of the body. So people with TB disease, you know, they're more likely to spread and cause infection in people that they spend a lot of time with. So we think a lot about, you know, the people in their family, maybe people that they drive to work with every day. We also sometimes think about coworkers or schoolmates. So this is a little bit different than COVID, where we're thinking of perhaps an exposure being very, very brief, you know, 15 minutes in a room with someone. With TB, we're thinking about this prolonged exposure cumulatively, so adding up over time. TB is not spread by sharing toothbrushes, through kissing, through shaking hands, through touching linens or a toilet, or through sharing food or drink utensils. So this is really an airborne illness. It has to be, you know, coughed or pushed out of one person with active disease's body and then inhaled into the lungs by someone else. So I want to talk next about the two sort of different outcomes and the two sort of paths that TB can take in the body. So as I said, not everyone exposed to TB becomes infected, and this depends on a lot of things. We have to think about how sick the person with active disease was. You know, were they coughing a lot, or did they have really mild illness? What were some of the other clinical things going on with them that can tell us someone has a higher burden of disease, just more germs in their body? We also have to think about the setting of exposure. Was someone exposed to the person with active disease inside, or were they outside, you know, at a picnic or on a sports team where we have a lot of air, a lot of room for air to move? We're a little less concerned about exposure in that type of setting. We also have to think about the size of the room. We have to think about airflow in the room. We also, with TB, we really look closely at the frequency and duration of that exposure. So was it just this casual, you know, passing on the street, or was this hours and hours spent on one day, or many hours over many days? So looking at all of those things combined. We also have to think about the medical characteristics of the person who might have been exposed. Someone with a suppressed immune system, for whatever reason, they may be more susceptible to becoming infected if they do have that exposure. So as I mentioned, there are really two related conditions that can potentially result from exposure. There's latent TB infection, or LTBI. You'll hear us use LTBI a lot. People with LTBI, they don't feel sick, they don't have symptoms, and they cannot spread germs to others. You can have LTBI for years. You could be infected, have it for years, and never have anything come of that. It's when there's just a small amount of TB germs in the body, and while they're alive, they're not active, they're not multiplying. The other TB-related condition is active TB disease. So this is when the germs in the body become active and multiply. People that are infected with latent TB infection can progress to TB disease, but again, not everybody does. We typically see, when you look across the lifespan of someone who has been infected, about 10% of people may progress to disease over that whole life after infection. So again, not everyone who is infected with TB becomes sick. LTBI and TB disease are different. With LTBI, we're not worried about exposing others. We're not sick. You will still usually have a positive TB skin test or a positive TB blood test if you are tested for infection. And there is treatment that we do recommend, and being treated for latent TB infection can prevent progression to TB disease. Someone with TB disease, on the other hand, they have a large amount of active TB germs in their body. Depending on where, if this is pulmonary disease, they can spread those germs to others. And they're probably going to feel sick and have symptoms. Some of those classic symptoms are cough and fever, but also weight loss, coughing up blood, and we'll talk about those symptoms a little bit more. Someone with TB disease is also usually going to have a positive skin test or TB blood test. And they could potentially have additional tests that are positive as well, and they may also have an abnormal chest X-ray if they have that imaging done. And finally, someone with active disease really needs treatment. It's with LTBI, it's less urgent. It is recommended, but with TB disease, this is really an urgency. And that treatment is taken very seriously and is monitored closely by a care team of a nurse case manager and a physician, typically through the health department. So again, untreated latent TB infection can lead to TB disease. We only see this in about 10% of people across the lifespan, but it is preventable with treatment. And this really happens if your immune system, if you've been infected and your immune system just can't stop the TB germs from growing. So they become active and they start to multiply. Latent TB infection is not rare. When we look across the United States, it's estimated that over 13 million people do have latent TB infection. So, they're living with that. And again, treatment is successful for preventing the development of disease. So I want to make sure that everyone is aware of the symptoms of active TB disease, and I mentioned these briefly before. And it can be really challenging to diagnose TB. Sometimes people will have symptoms that look like other things. They may have fatigue. We all have fatigue at times. They may have night sweats, which could be caused by other things as well. They may have a fever that's unexplained or chills. Something we see often with clients with active TB disease is unintentional weight loss, a more significant amount of weight loss. People often lose their appetite. They may not be interested in food. And then we have those really classic symptoms, that cough lasting longer than 3 weeks. Coughing up blood or sputum is sort of a real classic TB symptom. And that's really phlegm coming up from inside of the lungs. We also sometimes see people with pain in the chest. So again, you look at these symptoms and a lot of them could be something else as well. So it can be a challenging disease to diagnose, especially in places where it's less prevalent, like in the United States. So to reemphasize, people with TB disease are sick and they can spread TB germs. It is serious, but it can be treated and cured with antibiotics. It takes some time. People with active TB disease are treated typically for 6 months, sometimes 9 months or a year. And they do have additional lab testing and x-rays done. And then also the health department coordinates that follow-up with their close contacts and identifying those close contacts and determining who needs testing and then ensuring that is provided. So public health, your Hanover Health Department, your Greater Public Health, Virginia Department of Health team, that group is responsible for finding TB contacts. It's really one of our core functions still. And a TB contact is someone who is exposed to someone with contagious TB disease. So contacts often can include family members, they might include roommates or housemates, close friends, coworkers, classmates, and others. And here again, we have to consider all of those factors. how infectious was the person? What were they coughing a lot? What was the context of the exposure? Was it a small room? Was it over many days, many cumulative hours? All of those factors go into determining who context might be and who needs additional evaluation. So I want to talk a little bit also about risk factors. When we think about TB, we think about both people who might be at higher risk of becoming infected if exposed. So anyone can get TB. It does not discriminate. But some people do have a higher risk of becoming infected. So obviously people who have known contact or known sustained contact with someone with infectious TB disease, people who are born in or spend time in countries where TB disease is very common. This is many parts of the world. It does not include the US, but that sort of context of exposure can increase likelihood of infection. And then we also think about healthcare workers and others who work or live in places that might be higher risk for TB transmission. Congregate settings like homeless shelters or correctional settings can be a higher risk setting as well. Then we think about, if infected, who might be at higher risk for actually progressing and developing TB disease. We do see that those who have been recently infected, there's this sort of window where people are more likely to progress to disease. And then we also think about those with medical conditions that might weaken the immune system. So things like undergoing chemo, diabetes, or maybe you have very low body weight. Anything that is weakening your immune system can make it harder for your body to fight that infection, and potentially more likely that you would progress to TB disease. We're also always concerned for babies and really young children, so usually thinking about that under 5 crowd, since their immune systems are still developing, and they are also a bit harder to diagnose. So to talk about TB testing, there are 2 types of tests that we really use to diagnose TB infection. There's the TB blood test and the TB skin test. They're both good tests. If either test is positive, further tests are done to confirm or rule out TB disease. So we always want to make sure that if we see that positive test for infection, we want to make sure that someone just has latent infection and not active disease. And to do that, we always want them to have a medical evaluation, and we also want to see a chest X-ray. That really tells us a lot. So the TB blood test, which is what we'll be using for these testing events, it's pretty straightforward. Blood is drawn and then sent to a lab for testing. And someone with a positive blood test, that indicates that they've likely been infected with TB germs. And then, of course, they go on to have that additional evaluation with the health department. And a negative blood test means that a person's blood did not react to the test. And so latent TB infection or TB disease are not likely. You may hear the TB blood test referred to as an IGRA or an IGRA. And this is just another name for the test that means interferon gamma release assay. So people, some of you may have heard of BCG. This is a vaccine for TB disease, but it does not protect people across their life. And it's really not used in the United States. And people vaccinated with BCG can still get TB disease and can still have TB infection. It's given most often to infants and small children in countries where TB disease is really common, because it does protect in those young children against severe forms of TB, like TB meningitis. So again, this isn't something that's widely used here, but if you have spent a lot of time in another country, if you were born in another country, you may have received BCG as a child or an adult. And TB blood tests are really preferred for people who have received BCG. The vaccine can interact with the skin test and make it really hard to interpret, and it does not do that with the blood test results. So given that we get more accurate results for people who have received BCG in the past, we do prefer to use that test. So I also want to give a quick overview of treatment. Treatment for LCI can prevent the development of TB disease. If someone isn't treated, the germs stay in the body. And if somebody, has some sort of event and they become immunocompromised, or for some other reason they become ill, the TB germs may become active and multiply and could eventually make you sick with TB disease. So we do really strongly recommend taking medication to prevent the development of TB disease, even though you don't feel sick now. That can always be the preventative measure can be hard when you have no symptoms. Doing something to prevent symptoms down the road is sometimes harder to do. Treatments are relatively short now, typically 3 to 6 months, depending on which regimen your provider thinks would be best for you. And then when you really compare LTBI treatment to treatment for active disease, which I'll mention on the next slide, it's shorter and it just has fewer side effects. It's fewer drugs. It's much easier to complete. Treatment for TB disease, as I said, is incredibly important. It's urgent for people with active TB disease to be treated appropriately. They have to take several medications for up to for a minimum typically of 6 months and up to 9 months or a year. And this is in close collaboration with the health department. So someone with active TB disease is seeing a public health nurse sort of every business day, checking in on them and their medication progress. So it's a pretty involved process, but people usually start feeling much better very shortly after they get on the appropriate treatment for active TB disease. And also, very soon after they're on treatment, their potential to infect other people drops dramatically. So they become non-infectious very quickly after starting on these medications. So I'm going to hand it over to Karen with the Hanover Health Department to talk a little bit about what to expect next.
Great. Hello. Can you hear me okay? Great. Thank you. So I just want to start off with communication. So on Monday, the school had sent out the letter, and then on Tuesday, emails have, if we had accurate emails, were sent out. So please look in your email box and check your spam box to make sure that there weren't any emails there. And we also mailed out some letters in the snail mail in the United States Postal Service. So look in your mailbox there as well. So if your child or you were identified as a possible contact, you will receive this letter or email soon. The Hanover Health Department will be providing free screening and testing at Liberty Middle School on August 11th from 9 a.m. to 1 p.m. and then August 15th from 2 to 6 p.m. And you can attend either date. We do have a red cap for you to sign up for to register. And then you can also choose the date and the time that you want to attend. These events are only for those that have been notified of the potential exposure and not open to the public or the entire school community. If a staff member or a child has symptoms of active TB, please contact the health department or you or your child's primary care provider. And before the testing event, again, you can complete the registration form, which will be electronic through a confidential online survey. If you need assistance with that registration, please feel free to contact us at the health department. We have a call center set up to answer any questions and to help with this registration. And that is 804-365-3240. If your child or yourself were identified as having a possible exposure, they do not need to be kept separate from others in the household unless they have signs or symptoms of active TB, with which Laura had reviewed earlier in the slides. The staff member or child who received a letter was tested by their primary healthcare provider before August 10th. They should still attend this testing event as they need to be tested on or after August 10th. If a staff member or child has symptoms of active disease, please contact the health department or your child's primary healthcare provider. Registration will be finalized and a risk assessment will also be reviewed at the testing event. And we will talk about symptoms of TB, a history of TB, and any of the risk factors. and then you will be taken to have the blood drawn. Next, once we receive the results here at the health department, it'll take about 5 to 7 business days for us to receive that, and you will receive a contact by phone with the results. We will also provide a how-to to set up a LabCorp portal account to access those results quicker. If the results are positive for TB infection, you or your child will need a chest x-ray, and the health department will help coordinate this for you. If latent TB is diagnosed, treatment will be offered through the health department. And if the health department is concerned that you or your child have active TB, additional testing will also be performed. Thank you.
All right, well, thank you. One question that came in through the chat that I think that Laura could answer is, how was it determined who was exposed?
Thanks, Caitlin, and thanks for that question. So TB contact investigations are a pretty systematic process. There, of course, is some subjectivity. We can't know everything. And so the way that this list is determined is we think about the characteristics of the person who had TB. As I mentioned, we think about how infectious were they, and we figure out at what point do we estimate that their infectious period started and when did it end. And then we look at all of the people who may have had exposure to that person, and we add that up and figure out some cumulative exposure times and numbers, and determine those who kind of meet that criteria as our group of potentially exposed in our initial testing event.
Okay, great. One other question we got was, how many people received notices that they had been exposed?
So Karen might have to speak to how many of the notifications have already gone out, but through the investigation process, we identified a little over 200 people to include in this initial testing event. But Karen, I'm not sure the status for all of those notifications.
Okay, another question is, will school still be opening on August 21st? So I think that could be a question for Dr. Gill. So I'm going to unmute you.
Yes, there's no impact to the opening of school. All buildings will be opening on August 21st.
Okay, great. And another question is, have all the notifications gone out? So I'm gonna see if I can unmute Karen. Karen, would you like to address that question?
Yes, great, thank you. All the notifications so far have gone out at this particular time. They were mailed this past Tuesday.
Okay, thanks. And then we have a question. If someone receives a notification and doesn't want to get tested, what happens then? Laura, do you want to address that?
Sure. So, testing is strongly encouraged. If we've identified someone with potential, exposure warranting that testing, testing is recommended because we want to make sure that transmission, has or hasn't occurred, and if someone has infection, that we're able to offer them treatment. There's nothing that says they cannot continue about their daily life. They can still go to school, they can do what they want, but we do encourage that testing be accepted and pursued.
Great, thanks. And then, is it possible for a person with latent TB to clear the infection without any treatment? Laura?
So I guess that it might be possible. Usually once someone has a positive test for infection, it's not recommended that they be tested repeatedly, even if they've been treated. We don't look for someone going from having a positive test to a negative test as indicative of treatment being successful. Usually if you have a history of a positive test, you just wouldn't be recommended to be tested again. But apart from that, I mean, people absolutely have TB infection for their entire lives and are never negatively impacted by it. We recommend treatment because of the potential for progression to disease. But yeah, you could be infected for your whole life and never know, or never be negatively impacted and become ill.
Thanks. Another question is, why does the testing need to happen on or after August 10th?
So we make this recommendation based on sort of the time when exposure would have been, might have last occurred. And what we want to do is give the body enough time to respond if someone was exposed and infected, so their test results could come back positive. Sometimes if you test too soon and someone truly was infected after exposure, their body may not have had time to mount that immune response, and you may get a negative test. But from what we know about many years of TB, we kind of we've calculated out that appropriate amount of time for when the testing should take place in this particular event.
Thanks. Another question we have is, if folks aren't available on those two testing dates, August 11th and August 15th, let's say they're out of town or traveling, do they need to schedule a TB test somewhere else outside of the health department? Karen, did you want to answer that one? I'm going to unmute you in case you do.
Hi, yes, if you're not able to attend the two events, please call the health department. We'll be more than happy to schedule you into the clinic and do the screening and testing here.
Thanks. And just as a note, through the health department, there won't be any charges for the screening and testing or the treatment. So just know that is probably important as well. Let me see if there are any other questions, just a moment. Okay, there's one question, and it says, if a student tests positive, how would this affect their ability to start school on the 21st?
So a positive test for infection would likely not impact their ability to start school. You know, testing positive, people are going to have some symptom screening performed as part of their risk assessment. So if someone tests positive, they would then be recommended to have that additional medical evaluation and a chest X-ray, but you know, lacking any signs or symptoms concerning for active disease, there shouldn't be any implications for school start.
Okay, thanks. Another question is, can the health department test even if we did not receive a letter notifying them of exposure? And where can we go to be tested if we do not have health insurance? Karen, would you like to answer that one?
Hi, yes. You don't need to have health insurance to come to the health department, so you can definitely call and make an appointment here. If you weren't notified, you know, there's not a specific need for you at this time to be tested.
Thanks. Another question is, if a student tests positive, will they be allowed to attend school? Would they be required to wear a mask while at school? Laura, would you like to answer that one?
Sure. So again, I think similar to the prior question, as long as they don't have signs or symptoms of active disease, you know, they're going to need to get the chest X-ray, but they would not have, you know, limitations placed on activities, and masking would not be recommended.
Okay, and then there's another question, just wondering, in Virginia each year, how many TB infections are typical? So Laura, you might not have that at the very top of mind. We can always get back to you all if there are some questions that we don't have the statistics for. But Laura, maybe you know?
Yeah, so I can tell you roughly, and it's very rough because, latent TB infection, again, many people likely live in Virginia and have latent TB infection who aren't being tested every year. And we only started receiving reports about latent TB infection a few years ago. But we receive, in the past 2 years, we've received 8,000 to 10,000 reports a year. And so that's probably not the full picture. And I will say also that, so that's latent TB infection, and Virginia has around, it goes up and down a little bit, but around 200 cases of active TB disease a year.
Okay, great. Let's see, would people with active tuberculosis be allowed to come to school? If not, how long would they be out? Laura, do you know that one?
Sure. So people with active TB disease are going to be very closely managed by the health department. And again, we consider clinical characteristics and their treatment for when they're allowed to return to normal activities. But it usually does not take that long. The medications are really effective at reducing infectiousness. So after people have been on appropriate medication for 1 to 2 weeks, typically, depending on their other characteristics of their disease, they're often allowed to be released from isolation. There are some extenuating circumstances where someone might be need to stay out of activities longer, but that's monitored very closely by the health department. We actually visit those people daily to make sure that they're taking their medication. So when we do release people to return to their regular activities, it's because we know that they've had enough treatment and that they're no longer infectious.
Thanks. And there are a couple of questions about how TB is transmitted. Can you just reiterate the main ways that it can be transmitted and ways that it cannot?
Sure. So TB is an airborne illness. So when somebody with active TB disease, when they cough or sing or sometimes just speak, they expel those germs into the air, and then someone else needs to actually breathe them in, and then they move into the lungs. And for some people that they're not going to have infection, they're not going to have disease, and for others they will become infected or they could move forward with disease. But TB is not spread through sharing food or utensils or shaking hands or touching shared linens, anything like that. So it really is airborne, a respiratory spread of the bacteria.
There's a question about soaking. I'm not really sure what that means, but specifically wondering if it can be spread during soaking.
So smoking, I think I would look at similarly to sharing food. If you're sharing a cigarette, we wouldn't have concern for transmitting TB that way. Smoking can make someone more likely to become infected if you have some damage to your lungs. But I wouldn't look at sharing a cigarette as a transmission path.
Thanks. Another question is around the email notifications. So when should they have received those? So you should have received those already. If an email was sent out and notifying you about your child, if you're a parent or guardian. If you didn't receive those, you can call our call center and they can let you know if maybe we don't have an email for you or you're not on the list of someone who needs to be notified. So feel free to call us. It's 365-3240, and we're having operators live answering those calls as they come in Monday through Friday from 8:30 to 4:30. And they'll also return messages. All right, I'm looking to see if there's any new questions. Okay, I don't see any new ones right now, so we'll just wait 1 minute in case anyone's typing. Okay, so there's a couple questions about the recording. So yes, we plan to have the recording. We're asking Hanover County Public Schools to post it on their website, so that will be available for those who might not have joined on time or missed it or had any internet connection issues, or if you waited in the waiting room and they didn't catch you right away to let you in. So it will be recorded. Let's see. Any other questions that the community would like to enter? Feel free. Okay, so one from the schools is we are going to post the recording on the Liberty Middle School and Patrick Henry High School web pages. So feel free to go there. Okay, well, I think that's all for now. Thank you everyone for your time tonight. We appreciate it. And feel free to call us and let us know if you have any other questions. And just thank you again to Hanover County Public Schools for working with us. Have a good evening.